this podcast, Besa from MeryFirst talks about compliance and privacy in health informatics. So, stay tuned. So, welcome everyone to Future of Data podcast. Today we have with us Besa. She is a Chief Data Officer and Chief Compliance Officer for MeryFirst, a social service organization providing health and mental health services to children and adolescents in New York City. She oversees the research, evaluation, analytics, and compliance for health, REACH, that's a very clever name, for division, including data governance and security measures, analytics, risk mitigation, and policy initiatives. She's also an adjunct assistant professor at NYU and previously worked as a research director at USAID project in Afghanistan and as a senior director of research and evaluation at the Center of Evidence-Based Implementation and Research, CEBIR. She holds a PhD in implementation science with a focus on health services, an MPH in global health, and an MSW. Her research has focused on health systems, mental health, integration of technology to improve population level outcomes. With that, Besa, thank you so much and welcome to the podcast.
Thank you for having me. I'm actually glad to be here.
Beautiful. So why don't we go over your journey? I think it's fascinating. If you can walk our listeners and viewers through your background and what bring you here, and pretty much like your past life, that would be amazing.
Past life is always interesting to sort of look at, experiences. How did I get here? And why, technology? Actually, I started out as an engineering student in undergraduate electrical engineering. And then through 3 years of engineering school, I decided, electrical engineering back then, many, many years ago, wasn't all that interesting. I don't think it was that interesting. So I decided, I am going to go more into life and health sciences. But, my journey kind of went around in a circle. I'm kind of back with, data and analytics and the other components. After I switched out, I decided to get a degree in biology and anthropology. And then sooner or later, kind of, my career path moved more into social services and health services. So my next degree in line, I decided to, learn more about human interaction. Actually, a lot of those skills are very useful now. I ended up getting a master's degree in social work from NYU. And then, after I had my master's degree in social work, I decided, there has to be more. So right after, I decided to get a degree in public health. So I've been, school for many, many years. After I got that degree, then, with any new graduate student out there, I said, okay, what can I do with this? Mm-hmm. In that part, during that phase of my life, I wasn't sure if I was going to go directly into providing direct services or more into sort of the healthcare analytics component. It just happened that I just got pulled into the healthcare analytics component, and that kind of changed my career trajectory where I am now. After that, I worked primarily as a data analyst for many years, and it was a really good experience. So the skills that I actually gained in my master's in public health, epidemiology, population level science, I could actually see the outcomes based on initiatives that were being implemented. So it's actually kind of seeing the fruits of decision-making based on the data or the reports that are being provided, which is kind of interesting to see that kind of impact. Later on, after I did, social services for a little bit, I decided to do international work. But I've done international work throughout my career, sort of having that as a background. I worked in a community-based education project in Afghanistan for, several months. But prior to that, several years, I worked in Africa looking at health services primarily, and trying to figure out, how can we improve services to population en masse? And the best way to do that actually is through technology and technological innovation. That wasn't the case 10, 15 years ago, that a lot of, mobile devices weren't really available in the market the way they are now. So we see a huge proliferation as far as mHealth or mobile health, where 10 or 15 years ago, we weren't having these types of conversations. So it's actually a really interesting era to be part of. And in my current role, my goal is actually now I'm in sort of the heart and meat of utilizing everything that I've, studied, especially implementation science and understanding health systems and health systems approaches, that technology is integral, as well as information and flow of information is really integral to outcomes and population level outcomes. I think everybody knows about the Affordable Care Act and a lot of what's being out in the news as far as why are we spending all of this money, but we're not getting the same types of outcomes. And I think a lot of that has to do with ensuring that the care coordination is done in a way where we're able to see those chains. And I think one way to do that is infusing technology into the health sector in a very different way. So if you're interested in health or health technology, I think this is a really exciting field, especially now for a lot of people coming into this new arena.
Interesting. And thank you so much for walking us through your journey. Pretty fascinating and pretty diverse, and glad to have you on the podcast. So let's talk about your current role. Like, what is Chief Data Officer and Chief Compliance Officer means for a company like MeryFirst? What is MeryFirst, and then what's your role in it?
We'll resume after a short break. This part of the podcast is brought to you by First Friday Fair, fastest AI-powered way to find your next opportunity. Check out the website firstfridayfair.tao.ai and find your next dream job. Let's get back to the podcast.
So MeryFirst is a social service agency. We provide health, mental health care, foster care, preventive services, a refugee resettlement program. So it's a melee of lots of different programs, but primarily focused on children and adolescents. The key component is health and well-being for the most vulnerable populations, especially in New York City. That's where the organization actually functions and provides services. And it's really interesting to sort of think of the journey out there for a lot of the organizations, that you see a blending for different programs and different services in a very different way, and sort of the integration of the healthcare component. I think MeryFirst is kind of in that journey, that, how do you integrate all of these services in a way to improve outcomes, health, and well-being for the children and families that we serve.
Interesting. And tell me, what does a Chief Compliance Officer mean for that company, or what does a Chief Data Officer mean for that company? Or for the agency?
So initially, that's a very good question. I think initially when I came in, my role was a VP of Quality Improvement, and I kind of, along with Chief Compliance Officer on the side, serving as a Chief Compliance Officer. Especially in the current field, I think, when you think of quality improvement or improvement initiatives, doesn't really capture everything that goes on. And I think the new roles are coming into place, Chief Data Officer, Analytics Officer, as well as Compliance Officers, I think kind of capture more the current state of, where organizations are. As far as my role for a Chief Data Officer it's primarily a data steward, ensuring that there's structures in place to capture the vital information that are required for the programs, and have that information to be usable in a way that informs decision making. The other component of this role, obviously, is compliance, and that's a really important component. I think, I'm not sure how familiar people are with HIPAA or high-tech standards, health information technology, economic and clinical health laws, along with protected health information. I think with cybersecurity and some of the other gaps recently in the news, it's really important to sort of think about, information, the flow of information, as well as the security of information. So in my other role is ensuring that there's procedures, policies, and other things in place, that the information that is shared is protected and only the right people get the right information, to ensure that there's, proper care coordination across the spectrum.
Interesting. And I think, and by the way, thank you so much for walking us through that. And one of the things that I found fascinating when I was looking at your profile was that we rarely got a chance to talk to someone who's actually has some visibility on the compliance on the side of health informatics. And we have all heard about HIPAA. We all know that it's critical for health data. But I think, why don't you walk us through the world of compliance and privacy in health informatics? Like, what does it really mean and what's going on? If you can give us some of that perspective, that pretty much help us understand the importance and the role and the current state of compliance and sort of privacy in health informatics?
I think, especially now, it's definitely in the news with the new EU regulations that actually just got implemented May 25th. I think they're rolled out and implemented across the board. So the General Data Protection Regulation under the EU countries actually provides a lot of guidelines regarding what information can be shared and what information can be shared to second and third parties without the individual who actually provided that information. So it's creating lots of, buzz globally, actually, as far as what does this mean. And I know that a lot of people are getting the email messages, especially from organizations that do business within the European Union regarding opting in or opting out of having their information shared. It's definitely a field that's going to grow even further. And it's kind of interesting to see how those regulations affect business practices, as well as ensuring that the right information, especially for information technology, gets shared without barriers. So I think one of the really important components with compliance is that you have to love regulations. There's plenty of regulations across the board. It is, the way that the system is set up, but it's a good setup because in a way it puts checks and balances as far as what needs to happen. Sometimes there's a lot more regulations than, necessary, which actually inhibits, decision making in a very different way or delays decision making. There's always pros and cons regarding both. In my role is ensuring that whatever protected health information or any information that includes health or mental health data is secure, and any sort of exchange of that health information to a second or third party is notified in a way where the individual that provides that health information has given consent to share that information for the provision of health. So we're pretty good with monitoring that, along with our partners, obviously Department of Health and other oversight bodies have their own regulations to ensure that protection of health information is managed in a very different way. So including adding components for what common clinical data sets are shared across different organizations, or even within the organization, what security and safety measures are put in place. So then there is no security breaches. I think the most common sort of security breaches are usually internal within the organization, where somebody has a laptop with client or patient information, ends up, forgetting it or losing it, and then, opens up a can of worms as far as, client information that's within that laptop. So, as we're learning, as we're going, I think we're becoming much more sensitive to understanding some of the gaps that need to get filled and what, approaches need to be implemented to ensure, that there is no attacks from outside, which actually we get all the time, as well as, the human fallibility and the human factor, ensuring that there are safety and security measures. So, for example, one of the very common ways that, our therapists or clinicians or medical providers, physicians actually share information is via email. So email is the least secure, least protected approach to share any sort of PHI. So we put measures in place, and the next component will be to train our staff that any sort of identifying information, and it's a lot of information as far as what could be an identifier. Obviously, social security numbers, dates of birth, but even zip codes can be identifiers under HIPAA guidelines. And ensuring that everyone has that, map as far as, and a checklist, this is what falls under PHI, and these are the standards, and these are the regulations. But actually building in more automatic approaches where if an email gets sent out, then there's identification and a flag directly from the system that this email contains protected health information, and just locking that email and sending it securely through the portal to the other side. Obviously, when it reaches the other side, there's another issue that hopefully the partners on the other end are doing the exact same thing, securing the information, the patient information that we share.
Interesting. So from your vantage point, the current sort of regulatory infrastructure that's provided to secure data, do you think is it sufficient, or do you think that there are some sort of opportunities for like we need more regulations there, or like what's your thoughts on on the compliance side of things? That is it enough, or do we need more?
I think the regulations there are fine, and they're pretty, comprehensive regulations from Department of Health and Human Services that oversees, overall healthcare within, the U.S. sector. It's not the regulation, is actual the implementation, the resources on the ground. I think that's where you see the divide. That a lot of the organization, especially smaller organizations, do not have first the manpower, also the IT data expertise to implement a lot of these initiatives. And the second component, they don't have the resources to implement a lot of these initiatives. So it's not on the regulation side. I think it's more on the implementation side, that obviously resources are key to ensure that, anything is done appropriately. And then you have the right, individuals serving in those positions to ensure that they're managing and overseeing compliance related issues. So I think the implementation is where there's a huge gap. And resources, obviously, that's another huge gap.
Interesting. And so I think your previous background is in sort of these social projects, right? Where sort of data sharing is important. And right now you're working in a very regulated industry. Like, what are some of the things that are parallel between the two, or what are some of the things that are stark difference when it comes to sort of data and how it is managed and how it is sort of analyzed? Like, what's your thoughts on that?
We'll resume after a short break. This part of the podcast is brought to you by First Friday Fair, fastest AI-powered way to find your next opportunity. Check out the website firstfridayfair.tao.ai and find your next dream job. Let's get back to the podcast.
So there's a couple of projects that I'm currently involved in. One is actually looking at, mapping out the data within this enterprise. What information gets collected? Because every enterprise collects lots and lots of information. I think, in the early 90s and early 2000s, we were hearing about data lakes, big data. So yes, there is more information, but is it critical information? I think we're collecting a lot of information, but a lot of that information is not useful or cannot be used in the right way to inform decision making. So I think the most important component for any sort of enterprise, either it be healthcare or IT, social services, any sort of enterprise, is understanding what information they're collecting, how they're collecting that information, and ensuring that the information is hygienic. What I mean by that is that it's clean enough that when you analyze it upstream, it doesn't require additional cleaning, more data scientists to do additional work to get the data inside. The whole point of that is that you have all this information. You either want to monetize it or utilize the data for decision making. So that's really important, sort of understanding, what information flows through the enterprise, and then ensuring that the right information flows in the right ways. So including process mapping, every organization could benefit from that, sort of understanding, what are we capturing? Are we capturing, for example, if you are a retailer, capturing, how many items are bought. It might be important to capture when they're bought. So then that way you could sort of stratify to see, what resources you need to target based on time, a temporal component. All of those things need to be factored in when, you're looking at, the entire enterprise and the entire information infrastructure. I think that's really important for a lot of organizations. Once you have sort of a lay of the land, I like to call a map, then the next the next step would be, how can we automate and ensure that, processes are put in place, the data is pretty clean and, fed into a database. Almost all of the organizations have some sort of database or an electronic health record, especially in my world. Almost everybody has an electronic health record. But what I see from a lot of the electronic health records is there's a lot of data there, but it's not utilized. And I think one of the really interesting things that I see in the horizon now, especially for my colleagues at the university, is that, utilizing machine learning or AI platforms, different types of algorithms to sort of see patterns. But usually my, statistics and background, my training in analytics, I'm kind of wary of, seeing patterns when, just seeing patterns if we really didn't, structure the data in a way where you're collecting the right information. So if you have a lot of the information, you're seeing patterns. Sometimes those patterns are useful, but sometimes you could just be a mirage, that you could be seeing a pattern that's really not relevant. So I think that's always important to sort of think about, are we seeing the right things? Are we structuring our algorithms or our queries in the right way to answer the right question? And I think, for me, being trained as a scientist, it's really important to sort of have the question first and then build the analytic strategy later to sort of get to the question that you're answering, not vice versa, where you're, have an answer or have insight and then sort of, asking questions. Sometimes that could work, but I'm always wary based on my training that it could lead you in a very different way. The last component here is that once you have that infrastructure, electronic health record, is building in BI or business intelligence or analytics to make that data user friendly. And what I mean by user friendly is that, yes, I have individuals here, who are able to analyze the data, but sometimes it's not just the analysis. I think it's a translation of data. That's what's missing in a lot of ways. And a lot of the individuals that I see, even within the health sector or the health IT sector, or even the IT sector, are not able to translate the data. So they understand the information, they could run the analytics, but the most important component is taking this information and then feeding it back to the business processes for the decision-making approach, what I think that's where it's lacking. Another thing that we're tackling is sort of understanding, the interoperability between systems and how can we, unify different systems in a way where we have better decision-making and ensure that the client has they come to us for care, that their information is able to get transported to another organization or they get referred to another healthcare organization, that there's that continuum of care. I was in the emergency room this morning, and each time I go, and I'm like, I've been here, they're using Epic, which is a different electronic health system from where I was prior. And sometimes I wish that some of the insurance information would just be captured from one system to the other, rather than every single time a patient comes in, they have to enter this information continuously. So I think, there's a lot more work to be done, but I think it's a really interesting time to sort of think about, health information exchanges or data exchanges in a different way. Obviously we'll need to build these systems because we really don't have a ginormous healthcare data warehouse. I think that'll be fantastic, but I don't think that's going to happen any day soon.
Interesting. I think that's by the way, again, thank you so much for walking us through that. Because one of the things that we find from our interaction with folks from health informatics side. So on one side, data and analytics could do a lot more, right? They're because I think the beautiful thing about data in health informatics is there are real people and real life behind every statistics that you're looking at. And really, any analysis you could do actually could create a massive impact. On the other side, there's always a struggle on this compliance, whether you call it HIPAA and what, right? And then one of the things that we see a constant sort of outcry in this scenario was, hey, you know what? The regulation is pretty tight, and then the software or this infrastructure that we're using, it's very sticky. So when you have those two things working together, it's very hard to innovate. And I think and since the beautiful thing is you have that vantage point where you actually could make an impact because you are the chief data, you understand the data and its landscape, but regulations hold you back. Like, what's your thought on that? What's your perspective?
It's unfortunate that a lot of the regulations do hold us back in lots of different ways, as far as incorporating different types of approaches, analytic approaches, or linking. I understand the compliance that there has to be security around data, so information cannot flow freely the way I would like to flow freely, or follow the patient. Obviously, there's bioethics related issues as far as accessing information and using that information for population level outcomes. It becomes really sensitive because then you could identify a group of individuals that have higher needs, and those group of individuals, because their higher needs require more services, can be targeted in a very good way to improve those outcomes. However, on the other side, you have the insurance sector. There's a monetization sector. So in that way, they're seen as higher risk. Therefore, once you identify that client population, then, some services or even insurance services might restrict as far as, what can cover and what cannot cover, and what populations can be, brought onto the floor as far as their overall healthcare plan versus specific extra-additional coverages because of, their need. In my sort of, perspective, I think the regulations sometimes hamper, especially my work as an analyst and a scientist, that I cannot combine different data sets because of different regulations, or the regulations are such that takes a lot of time. I think the temporal component is a really key component, that in order to get somewhere, that instead of taking 2 or 3 months, it takes many, many more months than initially planned. So the plans that I have now, I think I'm just going to add another 6 months to that, because I think it just takes much more than initially planned to get anything done. But as far as integration of those data sets, because of those regulations, there's certain things that I cannot integrate and other things that I can, which limits my ability to sort of use this information in a very different way to inform decision making.
We'll resume after a short break. This part of the podcast is brought to you by First Friday Fair, fastest AI-powered way to find your next opportunity. Check out the website firstfridayfair.tao.ai and find your next dream job. Let's get back to the podcast.
Interesting. And so the other thing that that we are seeing that so if I'm a business, right, and say if I'm a healthcare provider, and I want to understand, or I want to hire say a chief data officer, or like, what should I look for? Like, how should I start with this journey? Because I'm sitting on a lot of interesting data, and that actually could really make an impact for my bottom line, even for the patient that I'm dealing with. What are some of the things that you could recommend before I get to this sort of mythical, magical unicorn called chief data scientist or chief data officer? What would you suggest?
It's funny because another colleague of mine said, "Oh, you have like those, trifecta of skills that, obviously, the background in health, understanding people, social services, and obviously my undergraduate was in engineering. So having somebody that understands the enterprise or understands the business, I think it's that if you do hire a chief data officer or chief analytics officer, that they really have to have that skills and expertise before you bring that on board. Not just an MBA, but I think it's important to have those soft skills to be able to translate the data for the business enterprise. But really understanding the analytics, the data infrastructure, and the IT component, I think that trifecta is very difficult to find. But if you could find somebody like that, where each of those components, I think, are key and integral to ensure you're bringing those data initiatives to fore. And, it's an interesting sort of position because, in a way, it's on top of the infrastructure, but it's between the decision making and the infrastructure, which means that I'm stuck with a big bag of lots of stuff. I always think of like a big knotted yarn ball, and trying to untie that and cut it and organize it and make sense of it. So I think the most important thing is to look for somebody who has proven themselves in the field, understands the field, that if they're coming in, if it's a healthcare field, that they have understanding of, health regulations. I think that definitely helps with ensuring that they're on the right path, or the learning curve will be much shorter than, if you bring somebody who doesn't have those skills and expertise. And having analytics experience, and as well as understanding data in a different way, in a holistic way. And on top of that, having leadership skills. I think that's another important component, that without having, the ability to translate this information, engage other stakeholders, it's really difficult to do this job. It's almost impossible, actually, because you really need people from different parts of the organization at all levels to participate. And if you don't have that participation, a lot of the projects fail. I have one project where I'm trying to implement an electronic way to administer medication. And I just see some of the challenges. It's been almost, 8 months. And we're still, in the process of just getting it implemented. And I think some of the challenges are the training and the different expertise across the enterprise that might, a lot of the people that come into healthcare or are coming in here because of clinical skills, because they want to work with patients. They're not coming in here because they want to enter everything into an electronic health record. But a lot of the healthcare now requires tracking at all levels. Each time you enter a hospital, they'll require data entry. So you see your physician, in front of a screen, just entering information rather than looking at you. That's very unfortunate, but that's, based on some of these regulations, I think patient care gets affected. But it is what it is. And that's
interesting.
Hoping that, with sort of more automation, that we could give more time to our physicians.
Interesting. And so, another interesting perspective I want your thought on is, so if I say I'm an executive, I'm going into this healthcare space, what are some of the things I should look for when I should pick out that if this setup is good for me or not? Like, what are some of the things that even you considered when you sort of thought about joining MeryFirst, and what are some of the things that you evaluate these companies on?
There's a couple of things. I think, well, before I was going to come here, I was going to take an academic position. And then, to the chagrin of my colleagues at this university, I'm like, I'm sorry, but I think I'm going to stick to, not teaching full time. I like for me, I think, I like the part of teaching, but I also like the part of doing. So for me, it's a combination between both. And I think when I was making that decision, should I just stick to academia alone, where I'm just in the ivory tower, writing policy briefs and lots of papers, sort of, ensuring that, health services move this way or that way, versus actually being with an organization on the ground and seeing some of the challenges. And I like that a little bit better, I think. Actually, I like that much better. That's why I'm here. That it gives me an opportunity to actually learn as I'm doing, and, inform research, inform policy by actually seeing what's happening on the ground. And I think if I was just in the academic universe, I wouldn't have that perspective, or I would have a very different perspective from just talking to people and, having them tell me, what are your challenges? Because in that way, I'm only seeing a sliver. It's almost looking at, a keyhole through a door and trying to, assess what the room looks like, rather than being in the room and you're like, it looks very different from what I thought it's going to look like. So having that overall perspective, I think it gives me a better approach to even develop policies and put out policies that are more user-friendly and more utilitarian, I think, rather than just, not having this perspective. I think that's really important to have a larger overview.
Interesting. And say if I'm a startup, and I'm venturing into this world of health informatics, what are some of the challenges that you would suggest that I should be ready to prepare to fight for, or what are some of the things that you think I should be prepared for?
Oh God, there's a lot of challenges in sort of the healthcare sector. Actually, it's one of the biggest sectors in the U.S. If you look at any other sector, healthcare sector is one of the biggest. It's kind of shocking if you think of like the health sector, pharma, that falls within the health sector as well. Pharmaceutical companies, if we're thinking of health information technology, if we're thinking of just social services, hospitals, insurance companies, managed care organizations. It's a huge, huge sector. So it really depends what niche of that sector somebody, want to observe or disrupt or upstart. But I think the most important thing is sort of having an assessment, what niche will you fill, what niche, number one, having a good understanding of that niche. And then second would be to understand, where the policies, U.S. policies are actually, currently, because that's going to give you lay of the land as far as what the regulations will look like in 5 to 10 years, as well as what the funding and the capacity will look like. And obviously funding is really key. If you're going to get funding from angel investors, or if you're going to get funding from grants, or, whatever it is, I think it's understanding, what niche are you filling in within the healthcare sector? And based on that, once you have a good understanding what niche you're filling in, then, ensuring that you have the right links within that niche to understand, just like I said, if I was in academia versus if I'm here, understanding what are the enterprise pain points. Once you understand that, then you're able to create plans and services that are able to target that. If you could build a better mousetrap, like they say, then, same thing with Uber. They're able to rethink the way we think of getting from point A to point B. Before Uber or Via or any of these services, I would have to sit there, either take public transportation, or I would have to wait for a taxi that would never show up. So it's a more user-friendly approach. It's a different integration between the individual that's seeking that service. And I think that's the same thing that gets translated into the healthcare, because now we have individuals that are more educated, number one. Number two, understand healthcare or their own health in a very different way. You see a huge proliferation of Fitbit, or just integration of different types of mHealth, mobile health technologies, that individuals are utilizing this on their own. And then even if you look at a Wikipedia, or even a lot of the health sections of Wikipedia, a lot of the consumers are much more educated. So if you're targeting a service, if you're targeting any sort of product, that it has to be with the consumer, the end user in mind, that in a way you're improving their health and without the actual time component. So if you could reduce the time with improving health, and providing the right information at the right time, I think that's also another critical component. I think that's where there's more room for development, and I'm sure that in the next few years you'll see more proliferation of niche companies that would fill that health information technology, where they reduce the gap between end user and service. I think that's where the future is going as far as health IT.
Interesting. And so, if we look at, say, your vantage point as a chief data officer and chief compliance officer, and if we sort of match it with other folks or other folks at leadership level that you have interacted with, what are some of the common sort of traits or some of the common challenges that you have seen that current data leaders are facing in health space? If you can walk us through some of those challenges.
So there is a group that we get together, sort of like the data health information technology. And it's really, one of the key things that we run across is people do not understand. It's sort of like this foreign land or this foreign language that a lot, when you say information technology, I think there's like an allergic reaction to that. And it's really interesting, there is. And a lot of the leaders, especially at a higher level, are not really trained to sort of look at information as something that's really key and integral for decision making, or it's part and parcel of the process, rather than sort of, highlighting a spotlight on and saying, this is important, and ensuring that this information is clean and timely and to the point is really important. So I think those things are kind of coming to the fore now that previously they, weren't thought of in that way. And that's really important. But another challenge that I have across, social service or healthcare, even, within those organizations, is educating, why this is important. Why is having this information important? And why is the security of this information important? So there's a lot of, teaching that has to happen, sort of getting people to understand first why information is important for decision making, for just process level, even for getting reimbursed, getting your paycheck. That everything is kind of like a chain reaction, and they're all tied together. And sort of understanding that is a challenge for a lot of us, especially in this field.
Interesting. And what are some of the things that you are pleasantly surprised with, that hey, somehow people get it? Like what some that say, I don't expect you to get this, but now, wow.
I'm actually kind of surprised that the millennials get it. That's a given. I think they're kind of, I see the younger generation have an easier time to adapt to different technologies fairly quickly and sort of incorporate a lot of those technologies fairly quickly. I was implementing an initiative here where, we would utilize more GoToMeeting instead of traveling. I'm like, well, let's, or, have individuals utilize, the full suite, start understanding all of the Microsoft Office products or whatever analytics products are provided out there. And I saw that the younger, or sometimes it's also enthusiasm, that once it's explained, once, you kind of show them the, steps or guide them, then I think it's easier for them to adapt. And a lot of that I think has to do with fear. Even for me, entering this field in the beginning, I remember I was having a conversation with a colleague yesterday, that all the analytics software in the beginning looked, pretty daunting to me. I'm like, I don't understand coding. What is all of this? And I had a little advisor that would not give up. It's like, no, go back until I actually learned. And I'm like, oh, eureka, I get it. But it took a lot of time to get there. And I'm also, realistic that not everyone will get that, as long as they get the gist of what we're trying to do, and how they're integral in that. And I think that's the most important components.
Interesting. And how do you see the leadership taking it? So I think I remember conversing with one of the executive couple of weeks back, and we were talking about how a couple of decades back, CIO was a remote phenomena, right? So information, we're just getting hang of it, and they say, no, just sit back at the remotest possible place. I don't want to see your face. Just keep the wires on. And suddenly the entire business became sort of very IT centric around IT, and IT became the spine, empowering every business. And now we know where the CIOs are today. The same thing is happening to the data and analytics side of things now, because they are perceived, okay, the remote one-off cases. What has been your experience? Like, do you see the same thing, or what's your vantage point?
I do see the same thing. It's kind of interesting. It's sort of like I'm there. In a lot of ways, I'm very vocal, so you can't ignore me that quickly. And I usually have a pretty good agenda as far as what plans I have and where I want to head. Sometimes there are a lot of hurdles to get to that point, but I'm pretty persistent that way. But it is like that, and even in my prior experience, sort of you see the analysts, they're out there, the ones that actually look at numbers, and they're pretty picky at decimal points and all of that. It's kind of compartmentalized. I think, I have a good relationship with our chief technology officer as well. So we are kind of, sometimes I say on a boat by ourselves. I'm not sure where we're rowing. And sort of explaining why this area is important, and it's becoming much more important. I think it's becoming, much more of a challenge. It requires much more interaction with other sectors, either fiscal or other components of the organization, that now it's becoming much more integral than in the past. I think with everything being tracked in such a systematic way that you really cannot get away from this. And that's, even for Uber, or even for, healthcare or any other enterprise. I think now they're understanding why these roles are important. You need to have the infrastructure, obviously, because everybody has to have that infrastructure. Everyone has a smartphone. Everyone has a laptop. Everyone has a computer, or the majority of people do. A lot of the businesses cannot function without systems in place. And then the information is sort of like another component that's really key, and it's coming to the fore. And as time goes on, I think once we have good approaches in place to ensure data integrity, have really good data stewards, I think the next component would be the insight from that information. So that's, I think, where the analytics, the research would come in as additional or adjunctive components. But I do feel sometimes that it's, really difficult to sort of translate this. And I think those are really important skills to have, is to be able to translate a lot of this, acronyms. We love acronyms in, IT or data or even statistics, lots of acronyms. And sort of taking away that mystique and making it very user-friendly on the end user, I think, increases the adoption rate. So then you don't have the laggards, you have the earlier adopters, as Rogers, sort of adoption theory says that, you need to have enough, sort of mass to sort of adopt these new approaches, and then others will follow once they see that, hey, this pilot is working, this is working. And I think that's where it's really key to have pilots or projects that see the light of day and actually improve service, and which means that a lot more things are automated and frees up additional time to do additional tasks. For our physicians or our clinicians would be to spend more time to interact with clients.
Interesting. And from your vantage point, so what is the fabric of a good data scientist or good data sort of data engineer? Like what, how do you, who do you define as an ideal data science leader in health space?
This is a really interesting question, actually. I mean, I see a lot of the blending, especially now. My brother is a computer scientist. So, 10 years ago, our paths were very different. I was in this, health sort of analytics universe, and he was in a computer science universe. And now our paths are kind of merging. And I'm like, oh my God, we're talking the same language. It's kind of scary. I understand you, you understand me. Oh my God. So I think it's kind of merging. And a lot of that has to do with a lot of the algorithms, the AI technology that's coming to the fore. But I think you need somebody who really has those critical skills or critical thinking skills. I think those are really key. And having a background and, obviously I'm kind of biased because my background is in statistical analytics. I think that's important. If you ask my brother, he'll tell you computer science and coding. But a lot of the software that I use now, even for statistics, requires coding like R or Python. So, and we're kind of using similar things. I mean, I'm not going to mention Fortran. That's like way back what I just studied. But in a way, it's merging. I think a lot of platforms are there merging. A lot of things are merging in a way with the analytics, with laying the foundation for getting information. Even the infrastructure, the way you manage information is changing. Things, a lot of the data now is moving into the cloud. They're not on-prem, they're off-site. Access is very different. So, all of these things are, I feel it's like a water flow that in a way, having somebody who really has critical skills, I think is really key. And understanding, programming along with the analytics, I think is also key. But the most important thing is having people skills. Because without people skills, I think, you're not going to be able to take whatever you have and then translate it.
Interesting. And so now let's talk about if I want to join this health informatics space, what should I do? Like, what do you recommend me as bunch of steps that I should follow to join, to make myself eligible?
So there's different paths. I mean, I went through the traditional academic path because I think that's, the way I decided to go. But like I said, my brother chose a different path. He actually ended up going into tech, right out of high school. And then he went back and got his degrees. But I did the opposite. I went directly into the university path. And then, once I had enough of the technical skills and expertise, then I decided to seek out options. So there's different paths of learning, doing versus, learning. They're different. I think, each of them have plus and minuses. He has much more work experience than I do in a lot of ways. But I think it's important to also, look at what others are doing in the field. So even joining, different groups online is really important to understand what others are doing in this field. Looking at different programs, there's plenty of, I always get notices for Masters of Analytics or undergraduate for analytics. So it's like combination programs now. Even I saw the other day, it's like MBA with information technology and analytics. I'm like, wow, it's like, merging of another field. Looking at what's out there, what others are doing, getting informational interviews from individuals in the field, sort of understanding their path and understanding, what not to do and what to do. I think that's also important. I would have probably done things differently, in my undergraduate, as far as sort of taking a meandering way and coming back to the same spot. But that's my journey as far as how I got here. Compared to others might have a more of a direct path where they go either to, get a degree in mathematics or get a degree in computer science, and then sort of, get additional training depending on, what niche they'll be targeting. But if they're, if they fall within the healthcare arena, I think it's important for them to understand, the arena itself as well. So having, I think my master's in public health was really useful. Understanding biostatistics, understanding sort of that part of it is really important. So it really depends on, future data scientists that will be out there, that what is it that they want to do. And the positive thing is that it's so broad. Now you have, you could be in any field and actually bring those skills, because like I said, every field now is kind of merging.
Interesting. And if you spend a few minutes on the fabric of your favorite hire, like, so if in your past someone you had really hired, what are the ingredients of someone you say, hey, pretty cool?
Actually, I just interviewed somebody, and I think, what I'm looking for is somebody who's pretty quick to pick up on things, pretty quick mind. I always, if I'm bringing somebody in, it's not that the content I could teach you, is having that critical thinking that's really difficult to teach, that I cannot teach you. I could teach you everything else, but having that critical thinking, or that mind, that inquisitive mind, detail-oriented mind, I think somebody who is also eager to learn, those are skills that I cannot teach. I could teach everything else. I could teach you how to program. I could teach you how to code. I could teach you how to analyze data. But having those components, critical thinking, somebody who's much more outgoing. I like to see that, especially in the staff that I bring in. I think my staff are a little bit much more reserved than, the other groups, I would say, in the sector. But having critical thinking skills, I think, is primary as far as what I'm looking for when I bring somebody on board.
Interesting. And if now I think we're almost at the tail end of the conversation. So let's now spend a few minutes on understanding your background and your journey. So if we need to say, count maybe 1 to 3 segments or 3 sort of ingredients that has really helped you stay successful and sane throughout these years, what would those 3 things be?
That's an important point, the sane part. The sane part is really important. Self-care is important, obviously, understanding. But for what really has helped my career is having really strong mentors in the field, that having somebody, that's why it's called a path. Somebody has walked through that road before. Somebody has been through that path before. So having somebody to guide you through that journey, I think, is really, really important. So seek out mentors, seek out other people that understand, that have been there before, and they could highlight areas that, you need to focus on, number one, or you need to fill gaps in knowledge. And they're brutally honest. I have, a few colleagues that are really honest, to the point where, like, well, that's, harebrained idea. Like, what did you even think of that? Or provide guidance as far as training. Now I'm getting more into AI. So, obviously, I don't know what all the trainings are, where they are or opportunities are. So having others invested in that learning and sharing that I'm interested in this area, can you help me? Can I learn from you? So having really good mentors, and also understand that, the field is changing so rapidly. It's really important to stay on top of, what are the current trends, and then follow those trends. Sometimes they lead to nowhere, but a lot of times they lead to somewhere. So it's important to sort of understand, where the field is going. And like I said, having a really strong mentor is absolutely key.
Interesting. And how do you keep yourself updated with WhatsApp? I think you spoke wonderfully a couple of times that, hey, this industry is expanding rapidly and technology is evolving pretty quickly. How do you keep yourself updated on? Like, what are some of the things that you do that really help you understand what's going on and how to keep on top of it?
So I'm actually, I'm on different data science portals that I've joined online, and I get, emails daily as far as, what's new in the field, for health IT, for data science, for AI. So based on the different areas, I've kind of sort of looked online, and there's so many different portals out there, or members or groups or organizations that you could join, where they're in that niche. I have a colleague of mine who's at NYU, and her area is sort of looking at, the data and the bias in the data, which I never thought about that before. I was at New York Academy of Medicine attending a training where they were talking about just the way that we have this data. Even for biometric data, a lot of that data is biased data. And we see a couple of those articles are coming to the fore because the way that they're coded, there's bias in the way we actually collect that information. And we don't really acknowledge that a lot of ways. We sort of infuse our biases each and everything that we do. It's not that it's biased, it's our perspective gets infused. So, if you aggregate that perspective, then you have a one-sided perspective. So it's really important to understand, how that information, flows one way or another. So she's doing some amazing work, sort of looking at, not only biometric data, the bias is in that as far as, identifying one individual versus another, but also looking at how, data is gendered, how data, the way it's organized is kind of, it's not as inclusive as it should be, and what steps need to be taken to ensure that is as inclusive.
Interesting. And I think one more thing. So we're almost at the tail end of the conversation. So, and again, Besa, thank you so much for being really generous with your time and candidly explaining the industry. So let's talk about your favorite read. I think this is something we love to, we ask all of our readers, and if you can share with our listeners and viewers.
I think I was mentioning this before, but right now I'm reading The Art of War by Sun Tzu. He was a Chinese general. And sometimes, sort of reading this old, books, it's kind of interesting to see that, people really haven't changed. A lot of the kernels of truth kind of, transcend time. There's a couple of things in that book that I think that are very useful. One of the important things that he was saying is that information means getting, facts timely, accurate, and meaningful. And I thought, wow, that applies currently. Having information that are timely, accurate, and meaningful are exactly what I'm doing now, millennia later. Another thing that, in the book that kind of got stuck with me, where he was saying that it's really important to understand the substance. So as far as the substance, like I mentioned before, understanding the lay of the land as far as what's there, to understand the climate, organizational climate, because every single organization, every single corporation has their own culture, and you have to function within that culture in order to bring about change. And change is not easy; it ruffles lots of feathers. It's really important to understand, the status quo and where things need to be pushed. And also understanding the structure, the leadership. And then another important component that was added was the information flow. And this was written many, many years ago. I'm like, wow, this is definitely applicable today. It's a really great read. It's, it's not that long unless you're reading, Machiavelli's additional books. But I would recommend that for any sort of person. It's a really good book as far as strategy. It's sort of preemptive strikes in a different way, but you don't think of that in sort of health IT space. But if you're in any sort of business, it's really important to understand, it's almost like a chess game, where you need to be, where you need to move, what sort of resources, allocations of those, what needs to, move, and how and when. And I think it's a really good read.
Interesting. I couldn't agree more. I think I remember a couple of months back, someone was joking that if you take the quotes of Art of War and replace the author, and you can just say data scientist, it will still be applicable. You can still believe that it's applicable. It's actually said by someone who's actually dealing with data. So it's a war out there. So
it's very different. I wouldn't say that's that bad, but it's sort of a new area that's still being developed. So understanding these tactics in any sort of new area or unexplored area or developing area, I think is really important.
It's pretty cool. And with that, Besa, again, thank you so much. Before we part ways, love to know if I would say one takeaway that listeners and viewers should take away from this conversation, and what would that be? So what would be your closing remark that you want to give to our listeners and viewers?
So I think for the future generation, if you're interested in this field, it's definitely a developing field. You'll hear much more about healthcare. It's not going away. It'll not go away. And you'll hear a lot more regarding sort of the integration between, artificial intelligence and health, and sort of how that leads to outcomes. But I want the readers to be wary of sort of understanding, some of the pluses and minuses of, if we're moving into this field, what actually does it mean for health and our well-being. The more information you put out there means the more information is available. So there's always pluses and minuses as a compliance person sort of thinking out, what's in the public domain as well.
Interesting. With that, again, Besa, thank you so much. You're always welcome on the podcast. It was an amazing journey, and thank you so much for sharing some of the interesting insights. And thank you.
Absolutely.
I thought I was sick of home, but actually I was homesick. Never really knew that I would have to grow up so quick. I'm so uncomfortable, don't know anybody here. Just a couple dudes that I met once, that's it. And I go into the booth feeling nervous. Got butterflies in my stomach like I'm so worthless. Is the mic on? I don't know how to work this. Inside I'm breaking down, I hope I'm not up on the